My name is Singh and I'm a North London ophthalmology trainee. In the first of a series of presentations, I'll be showing you how to enter cataract data on Medisoft. Medisoft is an electronic database for ophthalmology widely used in the UK. Good quality documentation on this database is important to ensure high quality patient care. In addition, electronic data are often used for audit and research purposes. For example, the National Ophthalmology Database. The first step to entering data for cataract surgery involves creating a surgical entry. This can be done on the home page of the patient of interest by clicking on the Surgery tab as shown by the blue arrow. Having clicked on the Surgery tab, this creates a window where one can select the type of operation. Often, during the day of surgery, an entry would have already been generated if biometry and pre-assessment details have been entered. If that is the case, the surgery appears on clicking the Surgery tab. Having created the surgical entry, this window appears allowing one to input data into the system. The first tab being visual acuity and co-pathology. It is vital to enter best corrected and pinhole vision, particularly for the eye operated, as this allows comparison at the post-op clinic. The co-pathology section allows documentation of various ocular pathologies, which may be reasons for guarded visual prognosis. It is important to document this carefully to ensure that all these are taken into account when reviewing the patient in the post-op clinic and also when auditing individual surgical outcomes. The next tab is the Indications for Surgery tab. The indication for cataract surgery is predominantly visual improvement, and this will usually have been generated by the system. However, there is also an option to add further indications, for example in patients with phacomorphic glaucoma, where the other aim is to reduce pressure. This can be done by clicking on the Add Indication button as shown by this arrow. Moving on to the Anesthetics tab, this section allows you to document the anesthetists and the form of anesthetic used, ranging from topicals to general. There is an option to input sedation and any complications from local anesthetic. The fourth tab focuses on the actual surgical procedure, where all the highlighted sections need to be completed to ensure the entry is generated. Of importance is the type and power of lens, and also the predicted post-operative refraction. The documentation of the various incision sites will also be useful for audit purposes. Also of note, there is an option to input if vision blue or femto laser has been used in the surgery. The next tab is the Other Details tab, which allows you to select any other surgical details from the following here or add any free text here. This may be a useful section to document if part of the surgery was performed by a second surgeon or a trainee. Complications may be documented in this tab by selecting any one of these following, or as before, there is a free text box to enter any further comments. Finally, the follow-up plan can also be documented on the system. There is an option to select whether the patient is to be seen by a doctor, nurse, or orthoptist during the post-operative clinic. There is the option to select the duration of the follow-up and also any further comments for the GP. This is particularly useful for documenting any further post-operative management plan, including post-operative eye drops. Having inputted all the data, the final thing to do is to save the entry. This is done by clicking on the cross, which here as shown by the arrow, which generates a pop-up window allowing you to do so. Thank you for listening.